much, Guru. I appreciate being here. It's been very interesting so far, and I've enjoyed everyone's comments. You are going to get a totally different spin from me. As a hospital owner, administrator, and also a doctor that still practices medicine. This act, the Patient Protection and Affordable Care Act, is an extremely comprehensive act. I was a very active lobbyist in this event, had many of the major people come to our hospital, including Nancy Pelosi, about 15 senators, met with them also in Washington. So I was very much on the field looking at this act as it evolved, and I have a unique perspective on it. First of all, the thing that's interesting about this act is this is the first national health initiative that actually had the formal support of both the American Medical Association and the American Hospital Association. Everything else that has been passed that's big has been opposed by one or two or both of these organizations. And that's an interesting story in itself. I think my fellow Chicagoan Rahm Emanuel had a lot to do with that. Might not necessarily want to know how he did it, but the fact is, though, that the American Medical Association, which is really the National Medical Association, currently at that time only had about 17% participation in physicians. It's actually lower now. Many of us quit the American Medical Association for the support. Jackson and Coker did a survey a month ago. Only 13% of doctors approve of the American Medical Association supporting the PPACA. And the other thing is, I know that my friends over here have spoken about Medicaid as a big thing. Well, you know, most of the people are not taking Medicaid. That's the problem. You know, only about a third of the doctors in Texas accept new Medicaid patients. I'm routinely asked to find doctors to take Medicaid who need it. And the reason is the reimbursement is just so low. You know, I see a brain tumor patient in the office, sit down, look at them. You can imagine the amount of training that it took me to get there, and I'm literally paid less than my wife pays to get a haircut. That doesn't add up, really. And I do it, by the way. I do see Medicaid. I do it as a service to the community because I am a doctor. But if you're going to push all these people into Medicaid at the current pay structure, you're going to have a very serious time finding providers to take them. The latest survey by the Doctor and Patient Medical Society found that 83% of currently practicing physicians are thinking of premature retirement because of the PPACA. In the American Hospital Association side, an organization I also have involvement with and don't necessarily agree with everything they do, it's mixed. Yes, they like an increased Medicaid enrollment because they get something, and I'll show you some slides, versus nothing. So they like that. But they don't like this $500 billion reduction in Medicare funding. And that isn't about efficiencies. That's the government saying, we're going to pay you $500 billion less over this period of time. And the reason we're going to do it, and this is the way it was sold, is there's all these people out there that have no health insurance. But with the individual mandate, that's why it's so central to the law, they will now have health insurance and you'll get money from them. So we can pay you less. And this Medicaid disproportionate share, that is an enormous problem. You know, for hospitals that have a huge Medicaid population, they survive on Dispro. They literally survive on Dispro. There's an amazing institution nearby here, Texas Children's Hospital. If you take away their Dispro, they will close their doors. And they see most of the pediatrics in this area. They are so concerned about this, they have permanent lobbyists in Austin just dealing with their Dispro. That's how critical it is for them. And as with everything with the government, not unique to healthcare, there's an enormous amount of burdensome regulations with this act.
What's the Dispro?
I'm sorry, disproportionate share is a funding, I do apologize. It's a funding mechanism where if you're a hospital that has a higher Medicaid rate than other hospitals, you get one huge lump sum of money at the end of the year, and it's huge. It could be up to $50 to $100 million. It's an enormous amount of money, and it makes hospitals who see these patients basically balance their books to survive. Most of those hospitals are nonprofit hospitals. They're not into medicine to make profit. They're just into medicine to keep their doors open. And there's been about 75,000 pages of regulations with the Affordable Care Act, and that's the beginning. That's just the beginning. Now, this act is not that popular with the American people. This is the Real Clear Politics poll of polls, and as you can see, about 50% of the people, since it was passed, want to repeal the law. And only about 41 to 43% want to keep it. So it is not a popular law, and it's still not a popular law. And I think the fact that it was only passed by one party in the government, first time that a major act like that has been passed by only one party, is probably leading to that. It's amazing, but this law, there was only one Republican that voted for the first pass in the House. He's from New Orleans, a representative, and then the second time around, there was 0 Republicans on both the Senate and the House side that voted for this law. And of the 26 governors that sued the American government over this law, every single one of them was a Republican, which is why this is an extremely partisan law, and yet it affects all of us. Now, the PPCA is patient protection, I imagine what they're talking about is their insurance reforms. We had a very good presentation from insurance folk. He talked about the pre-existing conditions, the lifetime limits, children coverage, other ERISA changes. I run a 2,200 employee plan myself. It's a heavy burden on us. Expansion of Medicaid, that's only as good as doctors to see the patient. There are no doctors. 33% of doctors are accepting new Medicaid patients in the state of Texas. 33%. At what cost do all of these things go to the payers? I was interested to hear that side. I didn't see it. But, the question is, A, if you limit the ability of profits that they can make, what's it going to, and you limit what they can charge for a plan, is the insurance going to be there? Okay, and are they going to be there? That's the next interesting point. And will employers drop out of insurance? When I was debating this with the Austin Goolsbee, a fellow Chicagoan, he didn't seem to have a very good answer to that, but that's another issue that we're looking at. And finally, there is no public option. So will access really increase? Okay, the public option was removed. Now, the public option in place would have resulted really in a complete government takeover, but no one can compete with the American government in insurance. It's just too big. So without that, the question is, will there be limited access to coverage in the private sector? The trend is not good. This is Texas. You can see the number of doctors accepting new Medicare patients are 65. This is before this law came into act. Here's the Medicaid, and it's getting worse and worse. And those, by the way, are the patients that need doctors the most, are the people in Medicare and Medicaid. Now, PPCA, the Affordable Care, it was supposed to restrict Medicare payments to providers by $500 billion. That's what Dr. Begley has in terms of the savings. Set up a public option to insure Americans at about 110% of Medicare. This was debated back and forth in the House. Set up an IPAB, this is Sarah Palin's so-called death, whatever she called it, death board or whatever, and provide subsidies to poor Americans. Those are still in place, and decrease the national aggregate health care